Good afternoon. I'd like to call the August 10th, 2015 Human Services Committee meeting to order. First of all, looking for approval of the agenda. We have a motion and support. Are there any adjustments, amendments? Seeing none, all in favor as written, say aye. Opposed, the same. We now have an agenda. Next, we have public comment. Are there any individuals that would like to address the board? Seeing none, we'll move on to committee items. The July 13th, 2015 meeting minutes are in your packet. We have a motion and support for approval of those minutes. All in favor say aye. Aye. Opposed, the same. Motion passed. Next, we have Lifeways. Mary Beth?
Good afternoon, Commissioners.
Hello.
All right. In your packet, you should have this month's report and a couple of things that I would like to point out in the report for you. First one is related to, it's part of our succession planning is around the development of leadership staff. And so in one of the steps that we've taken, this is the second year we've done this, is where we've implemented a 360-degree feedback for leadership positions within the organization. The two positions that are succession positions for my position is our Chief Clinical Officer and our Chief Operating Officer. So it's really important that this 360, this is our second year, that we evaluate how they're doing. And over the course of this past year, there were strategies related to leadership development training that was provided to really strengthen individuals. And when you look at the report, you'll see that overall, in almost every single area, there was improvement related to leadership skills. And that's important, especially when we talk about the two positions that are succession positions for my position. An outcome of the 362 is that there is a leadership development plan that each person develops. So they have both identified two areas in which they want to strengthen their leadership skills as a result of the 360, and I'll be working with them over the course of the next year to look at training opportunities and ways to enrich their skill set in those areas. So that is part of Lifeways succession planning, and that's an important thing that we've accomplished. And based on the results of this, it does indicate that the leadership training that we did provide over the course this past year was impactful. So that's good. The other significant thing that's happening at Lifeways right now is related to our general fund deficit planning. As I've talked every month to you about challenges related to general fund, and the fact that in June we experienced some significant further reduction related to general fund on our operations line item. So, and knowing that moving into 2016, it's going to be even more impactful that we really look at how we can create reductions in our spending around general fund. And the reason why it's important next year and not necessarily this year is this year we were able to carry over some of our general fund from the prior year. Years moving forward, the state, we will not be able to do that. So while this year the funding that we had not spent from last year that we carried over is what is meeting that gap for right now. Moving forward for next year, we're going to have a potential deficit of $230,000. So we are looking at things to cut those spending. And in this packet, I kind of talk about the 5 different major areas that we look at related to general fund spending and where can we have an impact. And one of those we've already started the process, and that's related to no longer continuing with our contract with MARA, which is our DHS agreement where we provide support for having an on-site staff person. We've done a lot as an organization to train staff internally around eligibility, enrollment, and do not feel that this is necessarily something we can continue to spend general fund dollars on. We've had discussions with Zoe around that and understand why it is that we have to make that reduction. And that will go into effect in 2016. The other areas that we're looking at related to general fund is around jail services. We had meetings with both Jackson and Hillsdale County, the undersheriffs of both areas, to kind of talk about the fact that we're going to have this deficit this next year. We need to look at ways that we can partner around jail services and how we might be able to collaborate on meeting that need, knowing the current financial challenges. So we're continuing those efforts. I have ongoing meetings scheduled coming up, and we're bringing DHS to the table because we believe there's a strategy in partnership with DHS that will help alleviate some of those costs on the mental health side. So I'll let you know as we know more, but we're moving down that road. The other significant areas that we look at when we look at general fund reduction is around some of our service costs. And unfortunately, we have two individuals who are in a very intensive autism program. When they expanded autism, we got a flood of people needing autism services and not having the capacity statewide. It was a statewide capacity issue. And two individuals were placed in a residential treatment center. And when they're placed there, you cannot use Medicaid dollars to pay for that service. So it has to come out of general fund. And the cost is pretty expensive. It's $1,000 a day per individual. So we're really working with the families, one, to educate them on this challenge, and the fact that we could provide services for the family in the home around the clock and still cost less than the $1,000 is costing a day in this specialized treatment center. It is going to be challenging because it is families are happy with the services that they're receiving there, but we are hopeful that our discussions with the family and them allowing us to also put into play one of the things when they expanded autism. We've expanded a contract with a provider that provides, without going into too much detail, but it's a form of evidence-based treatment for autism. And they've been doing it in the community and really trying to utilize that provider to provide the services in the home and support that individual and the family to bring the child back home. So we're hopeful that we'll be able to do that with these individuals and have a significant reduction in our general fund. And then the other one is around medication and the fact that injection medication is not a covered service. So when we provide that, that is a service coming out of our general fund. We're partnering with the Center for Family Health to look at 340B pricing, which would reduce the cost by roughly, on some of them, more than half. It wouldn't eliminate our costs in that area, but it could have a significant impact. So we're working in that area and are hopeful that we will be able to partner with the Center for Family Health around that. There's a lot of process and issues we have to work out, but I'm hopeful we can do that. The other thing that's in your packet is an update related to the local match. We continue to try to advocate at the state level regarding the fact that, because this is impacting general fund, what they're currently doing is they're reducing our general fund by the $426,000 annually. Due to the fact that we're not using our local dollars to make that match payment. We are wanting to ensure that those local dollars are valuable to our community to meet the needs. And statute does not allow, this is where, without getting too far into the weeds, statute indicates that the state cannot take general fund dollars to make a Medicaid match payment. Yet our contract with the department says that if you don't make the match payment, they can take it out of your general fund state dollars. Statute says you can't. Our contract says you can. I'm taking the argument with the state that you can't. Statute supersedes that. And right now, I've sent two correspondents. They finally have written back because I've asked them to put the general fund dollars back. and they're indicating that they can't do that they're complying with the contract as it is unless the legislature wants to take up the issue of local match, Section 428. I'm going to pursue my next route, which is to go through our grievance process, our resolution process in a contract. So I'm requesting that they formally sit down with me and try to resolve this issue. I know that's really complicated. I hope I tried to explain it at a level, because it is, why it is that we're taking that stance with the department. The other thing that's out there that we're working on as an organization that's part of our strategic planning is the state of Michigan is applying to be a pilot. You might recall when I talked with you about some legislation that Senator Stabenow had passed about Mental Health and Excellence Act. It gives the opportunities for states to be a pilot for a community mental health to become similar to the federally qualified health centers that you have locally. This would allow extreme benefit for community mental health to have some of those advantages related to funding and costs around what I just talked about prescriptions. The state of Michigan is applying to be one of the 8 states to be a pilot, and the state of Michigan then will select 8 to 10 CMHs to be a pilot. And I'm hopeful that Lifeways will be able to be one of those pilots. So one of our strategic plans is to align our organization to meet those elements, to be able to do that. So we are heavily involved as a leadership team, reviewing those standards and coming up with a plan to move forward. The other thing that's out there at a state level is related to the work group around opiates. I've talked a lot about the trends and the significant issue that's in our community around opiate use and how that leads to heroin use and the fact that we see an increase in heroin overdose. There is a work group that was put together. Lieutenant Governor Calley is leading it, and they're going to be coming out with some recommendations. There were some public hearings where people could attend. A lot of people that experience this challenge in life were keynote individuals that spoke at this hearing. So I'll keep you appraised as we learn as to what the outcome of the recommendations from the state will be. But I think it can only be a positive thing for our community when we look at the impact at a local level. Then the other thing is around the unfunded mandate, that there is a House package out there that's trying to look at the issues of the number of mandates that are unfunded. This is significant. I mean, from a county's perspective, it'd be something that I just want to be sure that you're aware of and you're tracking as well. And that is it for my update for Lifeways. I'm open for questions.
What questions or comments might you have for Mary Beth? Commissioner Rice?
I have a comment. First of all, I really appreciate you being proactive. Specifically, I mean, obviously many issues, but specifically when it comes to the GF, and also being very respectful of the fact that Jackson County is at the top of what we can do in regards to our local match. Obviously, if all of us had the money, we would, we could take care of this, but we can't. And part of what you're doing is certainly. Is something that we as commissioners have had to do with our own budget, is to look at what kind of services do we need and don't need. And I just want to make sure that the commission here realizes that, you're talking, I asked Mary Beth about this, the mental health court and the jail services that is provided by Lifeways is over $100,000. And I'm not suggesting that's going away, but that would be one way that Lifeways could save save money for the GF. They wouldn't have to pay that money to or utilize that money from GF if they didn't provide the mental health to the mental health court or the jail services. Now, that's not anything that any of us want, and I'm not saying that's going to happen, but that just goes to show you those services actually help us out here at Jackson County, because we don't have to pay for that. But on the other hand, they're needed. So you know, all this goes together and helping everybody out. We just got to figure out a way to do this. Last thing I want to say is we have discussed Section 428, which is part of the Mental Health Code, for a long time. And we have met with representatives and everything else, and it doesn't seem to me, from my perspective, anything's getting done. And I just like for us as a commission maybe to give some thought to letting our legislators know that they could do us a great deal of help here at Jackson County and with our community mental health if they would just tweak or change Section 428 in ways that's been recommended to them specifically by Mary Beth. So I just think we should look at that going forward, and maybe they would listen to all of us as a group. I don't know. Thank you.
Yeah, can I speak to that Section 428 just to let you know? I mean, there was a work group that I've participated in at the state level for the last almost a year, and we did have recommendations about how to, it was twofold, either to do away completely with Section 428, which there was a lot of belief that that probably wouldn't happen because there's a gap there, so who's going to fill that gap if you remove the $27 million? The recommendation was ultimately, let's phase it out over a 3-year period. Now, we passed those recommendations on to Michigan Department of Health and Human Services, who's our contractor, and we've also shared those with legislators, but it is important that we do get someone to support us in this effort. I mean, it's huge on the communities. That's $426,000 that can be spent on local services to meet the needs of our community versus drawing down additional Medicaid dollars, in which that's not for Lifeways. Medicaid funding is not a challenge for us, especially with Healthy Michigan expansion. All right, thank you.
Good afternoon, Commissioners. Good to see all of you. My report, of course, is in your packet, and wanted to highlight a few things that I made notes on over the weekend as some additional information came to my attention. You'll notice that we continue to do Ebola screening and monitoring. About 2 or 3 weeks ago, we actually received information from the World Health Organization that suggested that the country of Liberia was now Ebola-free. That appears not to be the case. They had some additional cases diagnosed in June. So while we were hoping that we begin to see everything ramp down in the West African countries that have been affected by the outbreak, we're still not there. I think that we'll get guidance from the CDC when that happens. And their criteria is basically no additional cases diagnosed for a period of 42 days from the last case that has been diagnosed in those countries. So we're a ways away from that. But I did want to let you know that we do have another person, another resident in Jackson County who is being monitored. They are low risk. They're not zero, but they're very low risk. And so we got that notification over the weekend. So we're monitoring that person. We continue to work, as I'm sure many of the departments have, on budget development. We had a meeting in the month of July to talk more about that and how we're doing with that. We think we're going to be able to balance the health department budget by making some adjustments on the expense side without having to make any staffing adjustments. We're very pleased about that. I'll be speaking at this year's 2015 Premier Public Health Conference on the topic of shared health officer services, health integration, and at the intersection of public health and the health system. I think it'll be very interesting for my colleagues in the state to know how we're doing here with our arrangement in Jackson County. Just got back from the NALBO annual conference. I will encourage in future years, if we have some board members or a board member who is interested in attending, it's a very good conference for those of you who work with us in public health on health issues. So I'll keep you informed on that as it comes up. It was a very good 2.5-day conference that I attended. Mentioned in my report as well that the Supreme Court ruling on the Affordable Care Act did get upheld, and I guess from a public health perspective we're pleased with that because it allows us to know that Jackson residents are now assured access to health care coverage that makes the vision of the Jackson County being the healthiest county in Michigan all the more achievable. So we're pleased to see that that was done by the Supreme Court. We have some new staff that were brought on board in July. Shanita Davis and Ashley Tanner are our new WIC breastfeeding peer counselors. We replaced an immunization clerk in the immunization clinic, Jamie Gullis, and we also brought a shelter attendant on board by the name of Janice Suda. So it's been a kind of a busy recruiting month, if you will, for the health department in July. You may remember late 2013, early 2014, when the health department was working very closely with the Jackson Health Network to develop orientation and training, if you will, of our mutual staffs. It's been about 18 months since we engaged in that activity last time, and now that we have new staff on board in both the health department and new staff on board in the JHN, which has continued to expand, it's time to do that again. So we'll be doing that beginning late this month and then into September as well. So these are just things that we have to do periodically based on having new staff come on board. We want to make sure that the JHN new staff understand what we do, and we want to understand what they do as well for our new staff. There was a cancer control grant opportunity that we were looking at for Jackson County. We were working both with Allegiance Health and, of course, with our internal programs in the health department. We wanted to pursue something on increasing the intake, if you will, or the rates of human papilloma virus vaccine uptake in our young people in the community. And I think we would have pursued it, but unfortunately, sometimes we just run into a crunch situation where we don't have the staff available to sit down and actually write the grant. And that's really, I think we face that same problem every year during the summer. It's vacations and all the kinds of things that don't work well for us. But I just wanted to make the point that if we're thinking about needs for the community, there are a lot of health grant needs that are out there, health grant opportunities that come along that we could apply for. I just heard about another one last week. The Michigan Health Endowment Fund is offering local impact grant awards for that as well. And that the Michigan Health Endowment Fund was created as a result of the sale of Blue Cross Blue Shield. You may remember that it used to be a nonprofit, now it's a profit, and those assets, portion of that was put into the endowment fund. But I guess my point is, if we had the ability to bring a grant writer on board here in the county, and if it could be shared on some sort of proportional basis across the departments that are likely to apply for grants, it can actually pay for itself relatively quickly. So I kind of throw that one out there as something that's a need in our community. I continue to participate in community resourcing, I guess in what you'd call the emerging collective impact environment. This has been an activity led by Allegiance Health, Prevention and Community Health, and Dr. Schultz, but also United Way and the Community Action Agency here in the community. And really what we're trying to do is figure out ways we can leverage our existing resources more to create systems change in the community. That's hard to do because so many of our funding sources are very much siloed and they're very program specific. But we're going to continue to work on it and try to find ways to do that. The next step for that whole effort is to create a pilot project that identifies a population, stakeholders, inventories of upstream and downstream resources, determine the scope of services and cross-sector strategies, and investigate mechanisms for resource alignment and select some outcome measurements. So we're trying to figure out how to move that model forward better. We did have a couple of reported communicable disease illnesses, outbreaks if you will, reported to us in July. There was a noro-like illness report reported in an Allegiance Health facility on July 15th. It has, of course, resolved since then. And there weren't any specimens submitted for testing for that particular outbreak, but everybody that needed to be contacted and informed and shared protocols for control, that was done. We also had a respiratory illness outbreak on July 20th. That was a particularly busy day during the month of July. We thought, and I think the facility also thought, that perhaps it might have been early influenza. They did 4 influenza tests, and all of those came back negative, so it must have been something else that we are not sure what it was, but it has also resolved in the facility. So nothing further going on there. We've continued to interface with the Rotary Club with the immunization outreach and advocacy effort. Dr. Lorenchuk and I attended Jackson Rotary Club's weekly meeting on July 15th, and he made a nice presentation to them, thanking them, and both of us thanking them very much for their up to $5,000 allocation, if you will, that they made for the outreach effort that took place in June and through part of July. I think we're we're going to be very pleased to have the Rotary Club as part of our Immunization Action Coalition, which we hope to have that first organizational meeting in October of this year. We had our maternal infant health program recertified, and that's good for another 18 months, and our entire MIP program staff did a great job, and we're really appreciative of the work that they do. We had a Medicaid outreach program review as well with MDHHS staff on July 1st, and we'll be putting together a Medicaid outreach manual for our employees and an Excel spreadsheet to improve tallying our numbers of activities. We didn't have any findings to be concerned about. It was just a suggestion that we're going to act upon to do that. I've had the county employee flu shot survey in my report for a couple of months. I hope to get to finalizing that analysis this week, God willing, and I have time in the schedule to do that. And as soon as we get that done, we will share it with the Wellness Committee and County Administration as well, and figure out what we could do more, if you will, to help encourage county employees to take the flu shot. Under health education and health promotion, I provided you an update actually from June 2015. We did share quite a bit of information with you on a wide array of sexual health, pregnancy, and birth indicators in Jackson County, and wanted to come back to you to share a little bit of information too about the abortion rate among teens in the community. We're really pleased to know that it's actually declining, because in 2009 there were 69 abortions in the under 20 age group, and in 2014 there were 28. So we've achieved a reduction in teen pregnancy that is not related at all to an increase in the abortion rate. So I think we're doing a great job. I think it's a really important piece of information to share with you. So it can also help, I think, set everybody at ease that the resources are being used correctly that we receive at the health department for the intended purpose. We've also received notice that the abstinence program continuation funding, we have an opportunity to apply for an additional $50,000 beginning in the next fiscal year, which is October 1st, and we have made that application. We will be required to serve an additional 100 teens through that program, and we're very pleased to receive that resource if we can compete effectively for it. I guess I could call this kind of good news. Hearing and Vision program funding allocations, the State Department of Health and Human Services came up with a funding formula for Hearing and Vision program funding. This is one of the mandatory essential local public health services that every health department in the state has to provide. And while I guess I could say I'm glad that we received an increase, it came at the expense of other health departments in the state. A lot of conversation and discussion about it at our local association board meeting this morning. I think what we're disappointed in is that it really should be a program that is 50-50 cost shared under state statute with the state. It has not been for years. There are some underlying reasons why that doesn't happen. But the bottom line is, if we could get 50-50 cost sharing, we wouldn't be having a conversation about creating winners and losers amongst local health departments. It's good that we have a much more defined formula, but we still are lacking in resources that we need to make health departments whole, if you will, in providing that service. So we'll continue to advocate for that. Looking at the rest of my report, Tobacco Prevention and Control Program funding is moving forward. As you may recall, there have been some changes in the specific objectives related to tobacco program control funding. We will be partnering, if you will, with the health system in our community to really look at more health system integration related opportunities for use of those funds. Service activity logging in environmental health, we're going to hopefully initiate that October 1st of this year, and our primary reason for doing that is so that we're ahead of the curve in the event that additional funding formulas begin to be developed by MDHHS as well as other state agencies. We need to make sure we can justify to you and to the community, if you will, the fee levels that we do charge currently for those types of services. Just makes sense that we need to do our job with collecting the data. Pets for Veterans was a successful event in July. I believe several dogs and cats were adopted, and we're always happy to partner with our community partners in that particular item. Proposed shelter staffing changes. We'll be meeting further with County Administrator Overton and Adam Brown to talk more about how we can move forward with increasing stability in shelter operations. We got some turnover issues that we struggle with. It does really take up considerable amount of time of our environmental health and animal shelter directors. So we know some changes need to be made in the future, and we'll work through the process for that. We did some facility improvements as well in the shelter per the Department of Agriculture and Rural Development requests, and I think we're pretty good shape at this point in time. And that's my report.
Thank you, Richard. I'd like to start by commending your department. Over the weekend, on Saturday, I was at an event for Partnership Park, a community event there, and you had a presence there with a group of local women that were definitely in need of the services that were being promoted there by the health department. So I
Excellent.
commend you for that. And then also yesterday I was down at the fairground, and you have a presence there as well. So it's nice to see that you have employees out representing the county in such a vital way.
We do.
So
We're
thank
pleased
you.
to be at the fair.
Thank you. Commissioners, any other comments or questions? No? Seeing none, thank you for that report.
Thank you.
Next on the agenda, we have the July claims. I believe you've all had the opportunity to take a look at them.
So moved.
We have a motion and support to pay the claims. All in favor say aye. Opposed, the same. Claims will be paid. Other minutes, there are none included in our packet. We have September reporting schedule on the board docs for your review. Next, that leads us to public comment. Is there anyone that would like to address the board? Seeing no public comment, is there any committee member comment? Seeing no other committee member comments, I adjourn to the call of the chair.